The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.
Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia. Good morning, Dr. Mencia.
Well, good morning, Anita. How are we doing today?
You're doing great. It's not St. Patty's Day yet, but we have a green shirt on.
We have green. Well, it's green and
gorgeous.
Brown.
Green and brown.
Trying to change the color tone.
Yeah, well, you look wonderful, and we thank you so much. And the weather's gotten better.
Yes, a little bit cloudy still. The cold weather still pushing toward Florida, but we're still fighting it.
And so are you getting a lot of people in with colds and sickness?
Absolutely. We're still getting a lot of, young patients that are getting concerned. And it was interesting. Yesterday, I had a young guy that came in. And he's one of those persons that, I quote him. I say, I have to be dying to see the doctor. So he came in, and he's in the verge of developing bronchopneumonia. And, of course, then I told him choices that we have, send you to the hospital. Number 2, come every day and get an injection because you're going to need at least 3 injections of antibiotic, plus the antibiotic by mouth. Put him on a short course of prednisone, very short course because he also has some issue with sugar. And he basically is coming every day to get his injections, and I think we're fighting this. But I'm telling people when they come in, it's a serious infection going around this winter, and people have died this winter because of the infection. Once you develop bronchopneumonia, that means it's going to go into your bloodstream. When it is bronchitis, it's very rarely to go into the bloodstream. You can still fight it. And it makes no difference whether we got the immunization or not. If you see that the infection is getting worse, the sooner you go and get checked, you might not need antibiotic. I have some of my patients that they come in and they say, can we do homeopathic medicine? They live close to my office, and we give it a shot. But at the same time, if they live far away, I say, take a prescription with you of a C-Pack or amoxicillin or something. Just take it with you in case it starts turning for the worse. And then the third thing that we do, which is the topic of today's show, is home visit. Some of the patients get decompensated to such a level that it's very difficult for them to go to the doctor's office, and we will provide home visit. And go to the patient and continue the injection. And the beauty with the home visit is that you also get the visiting nurse to come in. And when the doctor or the nurse practitioner is not there seeing the patient, then the following day, the nurse from the home health care agency will see the patient.
We had the personal experience with Bill, right?
With Bill, right. We did that, and we were able to treat him throughout the holidays. At home. And that's important because there's the misconception out there that home visit is for individuals that are homebound for the rest of their life. And that's not quite so. You can be homebound for a short period of time. Let's say, you fell down and hurt your back and you are unable to do things at home. You might be homebound during that period of time until they treat your back and you do get better. If you develop a urinary tract infection or a lung infection or a significant amount of diarrhea that is dehydrating you, and you are unable to go to the doctor, you are unable to go to the pharmacy, at that point you become homebound. And it's a temporary homebound. Once we get you better, then you are up and about and you are able to go back to your doctor.
I'm glad you clarified that. I didn't even realize the difference. Homebound then doesn't necessarily mean that you can't go anywhere. At that time, maybe
At that time,
you
right,
can,
when you
but-
cannot go to the doctor, for us, it's such a big deal, oh my God, the doctor coming. In Europe, it's nothing. In Europe, when I go to Germany, it's interesting. Sometimes I'm seeing the patient, and the doctor, the German doctor, usually come to the house and see the patient when they are unable to go. And they avoid hospitalization that way. In England, they do this a lot. And it's interesting when people from Europe come to America, because they call a hospital and say, well, I need a home visit. And, the other land will laugh and say, are you kidding me? Who are you? They think, you have to be so important to get a home visit. And it's very common. And you have a patient from England that called one of the local hospitals. And he called the hospital and he said, my 16-year-old daughter is extremely sick. And I don't want to expose other people to whatever she's having. We don't know what it is. Can we get a home visit? And it was a Holy Cross hospital, so they are aware that I do home visits, so they refer the patient to me. They all call Dr. Mencia. They do home visits. And that's another thing. Another of the myth of home visits is that we think it's for the very old people that are, in bed. Home visit can be for kids. You have kids with certain chronic condition, cerebral palsy or any of those conditions that prevent the parents from bringing the kids from doctor to doctor. And by definition, those kids are homebound. And so home visit is not for the elderly. I remember having a patient, and she lived in a 55-plus community or 50-plus community, one of those communities. And she was extremely sick, and the choices were hospital and she said, I cannot come to your house every day. So I said, okay, we'll send the nurse over. And my home visiting program was not fully developed, so I didn't offer her that. And when the nurse from the home health care agency came over, she was so offended because the neighbors started asking her, why are you getting a nurse coming to you? Are you that sick? Are you okay? Maybe you should move out of the community. And she got so scared that she sent the nurse, oh, no, don't come anymore.
Or don't come in white, those kind of clothes.
Yeah, exactly, yes. Yes, can you come dressed?
Right, like my friend,
Yeah.
right? But Dr. Mencia, you've just cleared up a lot of things. I mean, I always think I know a lot, but I didn't know that clarification of home visits. And that's
homebound,
really
yeah.
important. I just telling Dr. Mencia that I have a friend whose mother is apparently not doing very well at home. And she's, when you have a mother and you're a busy businesswoman by yourself, you go there at night after you're finished with your business and you try to take care of your mother, and it's just not enough. So now she's feeling very desperate. She has all these doctor appointments. And I said, stop. I said, I want you to call Dr. Mencia. I want you to go have their doctors and the people from their office to come and see what's really going on. And if your mom can come to his office for a big checkup, fine. If not, someone's going to go there. And I feel so good now because that's going to happen. And I'm so glad that you now have Armine. And I can't pronounce your last name, Armine.
Armine.
Armine, sorry. Armine, tell me how you pronounce your last name.
Karapetyan.
Okay. It's wonderful to have you here. I know Dr. Mencia is very excited about your kind of managing this whole system because, he has so much to do and his staff does. This way, you will be in charge of people calling and being able to get someone to get it done.
Yes.
And she's really good, with she followed through on with the patient. And last week we had a patient that called in and asked from Armine if we can arrange for a home visit. And she texted me later, and she said, I follow up with the patient. She was very happy with the services, and I was so impressed. I said, bravo, Armine, very good job.
And what are the kinds of service? Let's just go over that. So, okay, Dr. Mencia, so someone comes to your office, you have everything there. What happens when you go to their home? What do you bring with you?
Well, Armine know that we were having a meeting the day before yesterday.
Yes.
On Thursday. And the meeting, I was telling Armine and the staff that is going to be working with her, the full staff that will be working with her, the objective of my program, of the outreach program for home visit for homebound and ALF patient and retirement community. The objective is first to keep patient out of the hospital, second to keep patient out of ending up prematurely in a nursing home. And one of the main way we want to do that is by providing high quality care. So we prepare a suitcase with all the equipment that are necessary so that we can do electrocardiogram in the home, we can do an ear lavage, we can draw blood, we can get a urine sample. Anything that we are able to do at the office, I say I want to be able to do that during the home visit. And Armine will be basically heading this program along with Juan. You know, Juan was the one that took off with this program. And I used to do this. I used to have about 9 providers way back when I started practicing in South Florida. And we used to cover the Tri-County doing home visit. So we know the structure. We know how to restructure this again and bring it back to life. So I will be working right along with Armine so I can help her from the logistic point of view, what need to be done so that she look good every time she get, a facility or a patient that need the services.
All right, so let's go way back into the mentality of a doctor. I mean, you have a very different aspect of the way you care for people, but why haven't doctors done this? Why? I mean, we can always say that they're too busy and they can't, but what do they expect especially from elders? What do they think's going to happen?
Well, doctor, like people out there, we grow up with a storage room. You know how all the storage room are very popular and you get building full of storage room, right? So people grow up with storage room. If I don't have no use for this, but it's no garbage, let me put it in the storage room. Our storage room have become nursing homes. So doctor feel, this person is either coming too often or asking too many things that I cannot provide in my office anymore. And remember, geriatric medicine, unfortunately, is in extremely huge demand. There are not enough geriatricians to care for the baby boomer. Forget about Generation X coming up. For the baby boomer right now, we don't have enough geriatricians to care for them moving forward. It is so bad, really, that when I graduated, it was a 2-year program to become a geriatrician. They are trying to speed up the process and making it a 1-year program. So you have a lot of people that have done family practice and internal medicine, general practitioner, but they have not done the subspecialty in geriatric medicine. So once you become a geriatrician, the purpose of us is to always maintain quality of life. And yesterday I have a patient of mine that he said, you are not my doctor, you're my friend. And and he was saying, I depend on you, I trust you, and I do whatever you say because I really trust your decision. And he was just diagnosed with pancreatic cancer. And he told the staff in the hospital, they say, wait, hold your horses here. Let me go home, I want to see Dr. Mencia, because my objective is to, and he's, American-born, U.S. citizen, full-blown American. But he has a son in, I think, El Salvador, in Central America somewhere. And he said, my son is 5 years old, and before I die, I want to go there and see my son. I want to see my son and hopefully be able to bring my kid over. So he said, can you get me better? So we started nutrition, we started working with the patient, pain management, and we went beyond that. I have Patricia at my office, sit down, write a letter for the embassy stating that this person has a terminal illness. Please allow the son and the mother to travel over to the United States so we can get a speed up visa process to get the family over, just in case he cannot make it. But he is determined that his wishes is basically get me better enough for me to be able to go to Central America and be able to see my son.
Oh, you are so good, Dr. Mencia. That's the most beautiful story. And what you just said, how he feels about you, I think we all feel that way. We feel you are a friend. I mean, a very talented friend, but someone who just has a different side. And I guess this is inborn in you. I keep asking you, why aren't other doctors doing this? But it's like, everybody has certain qualities.
Yes.
And this is you were meant to be a physician.
Yeah, and I know.
Yeah, you were. I mean, it's just...
I was talking to somebody, one of my students that is rotating with me this month. And I said, since you were a little kid, you probably were thinking about being a doctor. They used to play being a doctor. And I say, not really. I used to fight, argue with my father so much. Like he would say something and I will, try to counter and say, no, it's this way or it could be that way. And he said, you like to argue so much. You should be a lawyer. You should be a lawyer. So he always told me I'm going to be a lawyer. So I even started college thinking that I'm going to go to law school. But then I did so well in science that we went on. Yeah, look where we are.
Is history, right?
Yes.
Yeah, well, when you just have a certain kind of a personality that, you can't invent or you can't educate, it's just there. But going back to the home visits, I think that people now understand more that it's better, of course, if you can, before you even get that sick, get to your doctor.
Of course,
get to your doctor.
Because you can rebound, and a home visit, when my staff, my nurse practitioner or my doctor, for example, Dr. Charles Richard, is doing home visit today. He's scheduled to do home visit today. And Armine basically is available to meet with anybody 7 days a week so that we can make the arrangement. So, if you need of us, and her email is Armine at agifl.com. You can email her or you can call at the office. We can give the phone number of the two offices.
We will give the phone number. We always wait too long. Everyone says, give me the phone number, give me the phone number. Okay.
And she will make all the arrangement, check with your insurance. And one of the patients she got was a patient that wanted to pay privately to get a home visit. And we accommodate for those patients, we get patients that will pay privately and because either they don't have insurance or what have you, but they need the care. But don't wait for things to get too advanced because we can do a lot of things early to help the individual in need.
The prevention. Let me give the phone numbers. Today, of course, they're open on Saturday in Fort Lauderdale. The AGI office is 954-489-1345. They're over there on East Commercial Boulevard, very close to Holy Cross Hospital. It's 954-489-1345. But now, if you are up in Palm Beach County and you want to make an appointment at their beautiful new Boynton Beach office, it's 561-270-6494. 270-6494. And if you want to, you call there if you need a home office visit. I'm going to give you the website, of course, which is agifl.com. AGI, it stands for Adult Geriatric Institute, but it's agifl.com. And something you should know that Medicare and most major insurances are accepted, and for home care too, aren't they?
Absolutely, yes. Home care, if you have any insurance or Medicare, Medicaid, whatever, we...
I know you're really quite good at that. So let's talk about something now that it's can if someone needs a shot, you go there. Will you give them a flu shot at home?
We'll do everything that we do in the office. Absolutely everything that we do in the office. As a matter of fact, even the the dermatologist is able to do home visit. That's unheard of, to get a dermatologist to come. Our podiatrist will go and do home visit. The dental department, if the patient have lost their denture or needs some urgent dental care, before the patient is brought to one of the dental office in our centers, one of the dental assistant will go over, assess the patient, and if it's a simple denture that they lost or broke, you can make an impression there on the patient, bring the material back, get send it to the lab, get the denture, bring it back to the patient without leaving the home.
You know, Armine, I know that you have worked in this field before,
Yes.
But you probably didn't have the opportunity for someone, if they needed dentures, to be adjusted.
No, definitely not.
Yeah,
So-
I think that gave her more power now for home visit, because the only thing she knew before was just physicians and nurse practitioner and PA going to the home, and that was it. Now we are opening for the podiatrist, the dermatologist,
The psychologist.
all of the
Psychologist.
services to come in and be able to work
Also,
with the person.
nutritionist.
The nutritionist
the
to come to the
nutrition,
home,
right.
which, Nicole
is.
have been doing home visits since she
didn't
started
know
with
that.
me. Yes, she does. And a lot of times she say, okay, I had to leave, no more patient. I had to do my home visits now. And she loves it. She really loves going to the patient house because she's able to go into the kitchen with them. And say, okay, let's talk about
No,
nutrition.
that's
I mean,
very
isn't that
interesting.
impressive? That's
Yeah.
very impressive.
It is.
I think.
So now
But let's talk about denture. I had to
Yeah.
tell you a story I heard yesterday from one of my dear friend, Wendy. And her mom was telling me, I heard your show with Dr. Arias, Sergio Arias.
brilliant
And I had to tell you
dentist.
what a brilliant person that is. I'm so humble, so nice. What an individual. Anyway, so she was telling me about those permanent denture. That's great. That's good thing, because I'm telling you something, and this truly happened. A friend of her, her and her husband, I guess they own this big company, and they both wear denture. And her denture doesn't fit properly, so sometimes she will take it off. And they are going to this gathering with all the family members. There are hundreds of people basically gathering for them. They are, very well known. On the way there, she took off her denture because, they don't fit properly. So they are dressed and they are in the car, and she took off her denture and put it on her lap. And they are driving there. They get to the place in the parking lot. When she step out, the denture fall down and break. So the denture broke, and now she cannot put the denture back in her mouth. And what to do? Because people are now waiting for them with the camera to take picture, to have this event. They are supposed to get up and speak.
Are you making this up?
No, it was a story. When she told me, I say, I had to bring that up in the radio. And I say, wow, what a great story. Because when we spoke with Dr. Sergio Arias, when I'm talking to anybody, I like to speak about the biopsychosocial. Tell me about psychologically, how this impacting you. Socially, how it is impacting you. Imagine how this person psychologically and socially was impacted. And
I don't
this
think
is a
she would
person.
have gone.
If she would not have been in the parking lot, probably I know a lot of people that would say, "Yep, leave me in the car. You go by yourself now. I'm staying here." People are waiting for you and expecting you. And what you're going to say? Oh, my wife couldn't come because her denture broke. So,
Wow.
so that was a very interesting story. I thought we would bring it up.
Absolutely. Well, that's been the problem, and sometimes people are eating and they fall out too. You know
Yeah,
that.
yeah, or speaking. You can see when they are
Speaking, right.
speaking, you see
Yeah,
the
they say,
denture
I
is not
know.
really,
So
they
it's
don't fit well.
fantastic. And then I just saw some pictures. Of course, in our next issue, March, in your column, he's written an article, a brilliant article,
Very nice.
with pictures. I mean, everyone's going to want that smile.
Yes,
It's gorgeous.
yes.
Well, Dr. Mencia, I'm so glad you brought Armine in, and we're
Thank
going to have a
you.
lot of work for you because we have a lot of home visits, Armine. And I want to just give the phone number again, please.
Yes, and if you
because-
like, you can give them my cell phone number also, and they can contact me directly.
Well, okay, but what's going to happen is a lot of people aren't going to take all these numbers, so we'll do that. But okay, 1 second. Let me just do this. Let's get you down to the Saturday open in Fort Lauderdale, the AGI office, and that's the medical and dental, and that's 954-489-1345. I'm going to give the Boynton Beach office also. It's 561-270-6494. And Armine, why don't you give your cell phone? And that's just to be used for business, please. Although she's very beautiful, we're just
Yes.
Thank you.
go ahead. What's your cell phone?
It's 954-918-5207.
Okay, let's do that one more time, slower.
954-918-5207.
Okay,
Very
that is so good. Well, we really appreciate that, and Dr.
Thank you,
Mencia,
Anita.
thank you
Thank you.
for coming
Thank
and
you,
talking about
Armine,
this.
for
And
coming.
you're
Thank
gonna, Armine, you're gonna call my friend because her mother really needs
I
you
will.
to arrange that. I'm so happy that you were here this morning. Dr. Mencia just bites off too much, and he always needs help
Well,
because he
I'm
wants
here.
to do everything. He wants to do everything. Thank you, Dr. Mencia.
Thank
It was
you.
a pleasure.
Armine.
Thank you.
We'll be right back with Jim Hansen.
Thanks for
with
listening to
Seniors
the Wonderful
Helping
World
Seniors
of
in just a
Wellness
minute.
with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.
The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.